For my final, I'm going to expand on my PowerPoint video on cold temperatures and the Panhandle and West Texas. We're expecting to see temperatures in the lows of 20s, so I figured this would be a appropriate topic. In general, when it is too cold or when we touch cold materials, our hands become numb. With numb hands, we're more likely to misjudge the amount of force we need to do our work, use too much, use too little. A cold environment also makes our bodies less flexible. Um, we're cold, not really wanting to move around as much. Uh, Muscles become tight. Every movement we make and every position we take takes a lot more work. More energy is being expended. More calories are being burnt. Work-related musculoskeletal disorders are more likely to develop. Of course, any fall on any surface is significant, but a stiff, cold person that can't move will be more likely to get hurt. Here's a picture that I pulled from a safety site showing a worker slipping on ice. As you can see, he's blurred, so it looks like he's moving pretty fast. Also, he's probably not wearing an appropriate amount of clothing for the type of environment that he's in. The footwear might not be appropriate. They have slip-ons that can help keep traction on surfaces like this. Also, as you can see, his body's contorted, sort of twisting. You can imagine injuries to the spine, hips, most definitely the extremities. Just as OSHA has a definition for people subject to heat-related injuries, which is heat stress, they also have a definition for people subject to cold-related illnesses, and that's cold stress, and that's by driving down skin temperature and eventually the internal body temperature. This can lead to serious health problems, cause tissue damage, and possibly even death. I'm going to talk about three types of cold related injuries that OSHA defines, and that's hypothermia, frostbite, and trench foot. I'm going to go a little bit more in depth on hypothermia, the stages, talk about the various stages of frostbite, and generally what trench foot is. I'm going to talk about three stages of hypothermia, which are mild, moderate, and severe. Mild hypothermia is below 97 degrees, above 93 degrees. With this, you'll see shivering, strong shivering actually. You're not going to see confusion. You'll still see a coherent individual complaining of being cold. With moderate hypothermia, you're going to see some confusion. You're going to see poor judgment develop. You're also going to see increase respiratory rates. If you take a pulse, you'll see some tachycardia or a rapid pulse. Uh, with severe hypothermia, you may see unconsciousness, if not just a stupor. Uh, you're not going to be shivering anymore. Shivering should have stopped. These people are at risk for death, and at this point, it's important for the safety not to rapidly move the person, not to shake the person. Any agitation of the body can actually cause the heart to stop. So, for the safety, the best thing to do in this situation is get them out of the environment. Um, Passively rewarm them, which means blanket, a warm room, um, and of course, call EMS. Summarizing hypothermia, hypothermia occurs when the body heat is lost faster than it can be replaced. The normal body temperature is 98 0.6. As I defined before, if it drops in lower than 97 degrees, that's hypothermia defined for you. Most likely to occur at very cold temperatures, but even can occur at cool temperatures. You can have hypothermia from somebody that's fallen asleep on a cold floor. Now I'm going to talk about the second MSD, and that's frostbite. Uh, OSHA defines frostbite as an injury to the body that is caused by freezing of the skin and underlying tissues. The lower the temperature, the more quickly frostbite will occur. Frostbite typically affects the extremities, particularly the feet and hands. It says sometimes people may require amputations. I'm going to talk about the 4 degrees of frostbite in this next slide. Now to talk about the 4 degrees of frostbite, which are first, second, third, and fourth. First degree frostbite is an epidermal injury, which includes the top layer of the skin, the epidermis. You can see the picture at the bottom of this PowerPoint here. It's skin that's had contact with cold air or a cold surface. The skin will appear white or yellow at the site of the injury. At this point, you don't have any blistering or tissue loss. The skin should thaw quickly. It'll feel numb um, and appears red with surrounding edema when thawing occurs. Second degree frostbite involves the epidermis and superficial dermis, so the whole top layer of the skin and any portion of the dermis, which is the vascular layer of the skin, including hair follicles. Um, this type of injury will feel stiff to the touch. The tissue beneath will give way to pressure. Thawing should be rapid. Uh, After thawing, however, the superficial skin will blister and there may be clear or milky fluid after several hours, surrounded by redness and swelling. There is no permanent loss of tissue, but it will take longer to heal, up to and including a month. Third degree frostbite is the epidermis and entire dermis. Now, this is much more serious. The frozen skin will be stiff with extreme restricted mobility. After the tissue thaws, skin swelling will occur, uh, and also you'll see blistering. Um, Skin loss will occur slowly, and sloughing of the skin will also occur. Healing is slower, of course. Fourth degree frostbite involves everything, dermis, muscle, bone, and this is where amputations occur. This next picture you'll see it will be a fourth degree frostbite from first degree frostbite as you look towards the ankle of the foot. Now here's some severe frostbite for you that I found. If you look at the toes here, they're black. He's gonna lose all these toes down to the proximal knuckle. Um, as you and this looks like he's been thawed already. So as I described before, you're seeing the redness that you see like in first degree frostbite, the slothing of the skin that you see in second and third, and of course the black necrotic or dead tissue that you see of the toes. Now the last cold related MSD, the third, which is trench foot, also called non-freezing cold injury to those in the medical field, or NFCI, or immersion foot injury, is caused by prolonged exposure to wet and cold temperatures. It can occur at temperatures as high as 60 degrees if the feet are constantly wet. Non-freezing injury occurs because wet feet lose heat 25 times faster than dry feet. To prevent heat loss, the body constricts the blood vessels to shut down circulation of feet. The skin tissue begins to die because of the lack of oxygen and nutrients due to buildup of toxic products. Um, this looks like when you have your when you're in the pool too long or the bathtub too long, your skin starts to wrinkle. Um, Same kind of thing, except you have also a cold environment issue involved. This next picture shows trench foot, which I'll explain. Here's a severe form of trench foot. As you can see, the feet look cold, pale. The skin is appears to be separated from the underlying tissue, which is truly what's going on. The best thing that the safety can do is get them out of the environment as long as there's no other injuries going on. Can't let these people walk. Don't agitate the area or try to rub the area. You're just going to slough off the skin. Passive rewarming is what you do. You just put them in a warm room, let them dry, uh, let the tissue come to room temperature on its own. And that's the end of my PowerPoint. I enjoyed the class. Hope you enjoy your holiday. Thanks. Bye.